Hello again, everyone. We're getting ready to start. We're talking about physical activity. So hope you guys are going to have a good time tonight with our webinar, and hope you can walk away with a lot of tips and ideas on how you can improve with your physical activity.
And also a better understanding of what it is to be physically active. We
Mhm.
get lots of questions, from our patients, from you guys actually, on what you can and can't do based on health issues, it's based on age as well. So we kind of want to put this together to hopefully answer most, or if not all of those questions. And honestly, if some still persist, write them down. And after we're finished, we can definitely approach them and answer them to the best of our abilities.
Absolutely. So we'll talk a lot about, as Dr. Morris said, just kind of an introduction to what it is,
Mhm.
and also focus a little bit on some age groups that we get more questions from as well too. All right.
So let's talk about the health benefits of physical activity. So we know that there are different types. Usually we think of it as moderate to vigorous, based on, your health status, and we do know that being physically active does help reduce your risk of many other adverse health outcomes that are out there.
Mhm.
And of course, some activity is better than none. So we do recommend our patients, instead of being the couch potato or not being as active, just doing something, even if it's
Right.
walking your dog or going out to the mailbox a couple times,
Mhm.
just kind of doing something that's gonna get your muscles engaged. Okay, and we do see that there is benefit occurs with regards to doing more of the intense type of workouts versus
Mhm.
nothing at all, and also increasing your frequency and slowly over time increasing the duration of your workouts or your physical activity does help improve overall health. We do see that for patients, the benefits occur anywhere from 150 to 300 minutes. And that's an industry standard that we've seen. It goes
Mhm.
for basically all adult age groups. So it's kind of that number you want to look to
And that's per
position yourself
week.
eventually. And
Mhm.
that's 150 minutes to 300 minutes per week. So it's spread out throughout the week and your daily routine. You know, the health benefits of activity transcends all age groups, all races, no matter what, all the data points to it. Being more physically active helps reduce adverse outcomes and helps honestly improve overall well-being.
Yeah, absolutely. Okay. So this is just a broad overview of types of physical activity. So when we talk about activity, you usually say, how much aerobic activity are you doing? That's your cardio activity. That's the activities that you're going to be doing that will get your heart rate up. And you can feel that blood pumping, get sweating. That's aerobic activity. So if you're walking, jogging, biking, activities like that, and that those are very important. But also we want to make sure that we emphasize muscle strengthening and balancing activities too. So muscle strengthening are like your weight bearing exercises, whether you're going to the gym and using the machines there that are specific to upper body, lower body, etc., whether you're using free dumbbells or whether you're actually just doing your own body weight exercises. And so you want to maintain the strength of your muscles, because as we get older, unfortunately, our muscle mass tends to go down. So we want to make sure that we're maintaining muscle strengthening exercises. It helps with muscle and also bone health. That's really
Yes.
important for women as we get older with hormone changes, osteopenia, osteoporosis, etc. And of course, we can't forget balance and flexibility activities. Again, as we get older, balance tend to be an issue. We want
Mhm.
to make sure that we're maintaining our balance, whether it's walking, doing other activities. We don't want to lose, certain physical abilities. So we want to maintain our balance. And this is really important, again, as we get older, but also important when you're younger as well, too, and that's why activities like yoga and stuff like that is really important.
So a little slide on HIT. So HIT is high intensity interval training. So I'm sure, well, hopefully most of you know what it is. You don't have to
Mhm.
partake in it. It's something that I do personally, and it's one of the ways I work out. So by definition, it's basically alternating short periods of maximal effort exercise with less intense recovery periods. So you're going hard for whether it be a minute or 45 seconds, and then you're resting for 15, 20 seconds,
Mhm.
and you're going hard again. So that's one way of exercising, and there is no real industry standard or universal way to do it. as long as you get to your maximal effort doing the activity. So whether it's push-ups or mountain climbers, and usually a lot of HIT or the HIT workouts that I do are heavily based on calisthenics, which is your own body weight, which makes it much easier to do. So something you can do at home, and these are normally ran in cycles, meaning, okay, I'm going to do 5 of this, 5 of this, 5 of this, and that's up to you. You just kind of pick what suits you and what works with your schedule,
All right, so we're going to talk about intensity, and we're going to get a little technical here because I always have people asking, what is a light intensity? What is moderate? What is vigorous? Just categorizing that. So to be very technical, energy expenditure is measured in METs. METs is a metabolic equivalent of task. Basically, it's the rate of energy expenditure while sitting at rest. So basically, my MET, and it's different for everyone based on their metabolism, based on their weight and height and everything. So it's usually measured by the oxygen consumption, if you want to get really technical in there. But so me sitting here at rest, this is what I'm expending at my baseline MET. So light intensity, basically what's equivalent to up to 3 METs. So whatever energy you expend at rest, up to 3 times that. So these are typically very slow exercises, such as walking at a leisurely pace, cooking activities, light household work. Moderate activity is between 3 to 6 METs. And these examples are like brisk walking, playing doubles tennis, and
pickleball.
Doubles, though not one-on-one. That's a little bit more vigorous. And rake in the yard. Those are some examples. Vigorous intensity is 6 or more METs. So, once you cross over that threshold 6 times what you're expending at rest, then you get into your vigorous intensity exercises. So you're jogging, running, carrying heavy loads, groceries, especially up the stairs, shoveling snow. So you see, it doesn't have to be an exercise. It could be an activity that you're doing where you're actually, expending a lot of energy with some kind of strenuous exercise, and that would classify as vigorous intensity. So just to give you an idea of how it's technically classified, but we'll go through between Dr. Morris and I and talk more about types of intensity with respect to exercise further on in the presentation. And this is just a list that you have, and you can read about moderate and vigorous activities. So you can always take a look at this later.
So let's talk about the effects of being active on chronic health conditions you may have. So we kind of picked a couple of the more common ones we see in our primary care practice and put this slide together. Now, a lot of the data we're going to present was courtesy of the Obesity Medicine Association. Dr. Bacchus and I are both members, and we are boarded in obesity medicine. But it holds true for everyone. So let's start off with diabetes, which is a huge problem today in primary care. Being physically active does help improve insulin-mediated glucose control. Exercising does help to build the muscle and allows the muscle to be more effective with getting rid of glucose, because glucose meaning using glucose for muscle function. And of course, huge impact on the visceral fat. Visceral fat is that fat we know that's in the gut region. And it's not what you can feel, it's what you can't feel. It's that fat around your organs, your intestines, your liver, all those gut organs. And that fat is not very good. It has a lot of negative mediators, a lot of neurohormonal signaling, inflammatory mediators that can worsen chronic health conditions and put you at risk for worsening heart disease, diabetes,
it's that dangerous fat.
That dangerous fat that we do not want people to have.
All right, let's talk about the cardiovascular benefits, which most of us, I think, know that this is huge. Just based on all of the studies that's been looked at by the Obesity Medicine Association, they came up with these statistics here. And so you can see here that you can have a huge reduction in cardiovascular disease just by increasing your activity level. So this particular study looked at calories per week and the percentage reduction in overall cardiovascular risk. So you see here, you can read 200 to 500 calories per week was a 27% reduction, 600 to just under 1,500 calories per week, a 32% reduction, and even over for those that really love doing this stuff and really put it all into it, over 1,500 calories per week actually is up to 41% reduction. So huge. I know a lot of us have, genetic predisposition for cardiovascular disease. This is one way in which we can help to fight it and decrease our chances there with respect to heart disease. And just a few points on how it helps the cardiovascular disease function. It improves endothelial function. So endothelial cells are those cells that are lining our vessels or arteries and our veins. And it helps to reduce the inflammation in those linings. So definitely helps with better function in there. When you exercise, you're improving your cardiac output, you're improving your heart function, you're exercising that heart muscle. So that definitely helps. Perfusion capacity of the muscles. So perfusion is how the blood flows through your different tissues. And when you exercise and you use those muscles, you're getting a lot of blood flow there. You're keeping your muscle nice and healthy and maintaining your muscle mass. Blood vessel wall thickness and resistance reduced. So as the resistance go up in your blood vessels, it actually leads to higher blood pressure. So this is what it says: exercise helps with blood pressure reduction. So many different benefits from just physical activity. Okay, sorry, our slide got stuck here. Give us just a moment. Okay, there we go.
And hypertension, Dr. Bacchus just mentioned, so you can see a drop in blood pressure by 5 to 7 millimeters of mercury after you exercise, and that's because of what she mentioned, the improvements of vascular resistance, just by the fact that you're being active. Joint health, huge. So a lot of people will say, you know what, doc, I have arthritis, so I can't work out. And that's actually not true. You have arthritis, so you should work out, meaning we want you to work out or exercise or be physical within your current set of limitations. So what that means, you wouldn't go run a marathon if you had really, really bad knee arthritis, but you figure out what can you do. You adjust. So you do some walking or some swimming if you can. But we do know that being physically active is very good for joint health, and it improves the strength of the muscles around the joint, which is important. It helps to improve the joint's range of motion, depending on what movement you're doing. And overall physical function is better, posture improves. Anything to do with muscle mechanics and joint mechanics is improved through physical activity. And there is also decreased disability and improvement in pain and stiffness over time for those of us who engage in physical activity despite having some joint issues. And once again, the caveat is within your limitations. Your body will tell you what it can and can't do. And the more you do, you find that you may slowly begin to improve and increase your duration of working out.
Depression and other mental health, huge benefit of exercise. It helps to elevate your mood. When you exercise, you release endorphins that your brain loves. It helps you to be happier. It helps you to feel better. So not just depression, but other mental health. Exercise has lots of benefit for your mental health. And the big one is cancer. Again, statistics that's taken from multiple studies that's been looked at from the Obesity Medicine Association shows some really overwhelming, just rates of reduction in certain cancers. We pull these ones. There's a 10 to 70% reduction in colon cancer risk in physically active adults compared to those who are not physical. I mean, that is pretty big. 30% reduction for postmenopausal breast cancer. That's the initial occurrence, but an even bigger reduction, 50% reduction in recurrence of breast cancer. And breast cancer, like one of the most prevalent cancers now, unfortunately. So, you can see the effects of physical exercise with respect to that. And overall, in looking at overall cancer patients who participate in regular physical activity, there was a total 37% lower risk of dying from that particular cancer compared to those who did not exercise. So, I mean, the numbers speak for itself. Lots of benefits of physical activity.
So let's talk about activities for older adults. So, I mean, and this is what we get asked more often than not. And you can see some of these kind of mirror the list we had earlier. So walking, hiking, dancing, swimming, water aerobics,
Mm-hmm.
which I think is it's a really, really good one for anyone with joint
Right.
impediments, doing things in the water, aqua aerobics. Yoga is key to help, well, it is rated aerobic here, but some forms can be, but
Mm-hmm.
most times we use yoga more for flexibility. Playing tennis, or even a small pickup game of basketball is good for aerobic exercise. Muscle strengthening, obviously important to mix that in with your aerobic activity, which we mentioned before. Body weight exercises, and using resistance bands
Mm-hmm.
is also a good option for those of us trying to build that muscle.
All right, continuing on tips for older adults. This is a 65 and an older population. Recommendation is to do at least 150 to 300 minutes of, if you're going to do moderate intensity exercise, and that's over a full week. If you're more into the vigorous intensity exercises, 75 to 150 minutes is the recommended. Okay. And so it's been shown with more aerobic physical activity, that's the one that gets your heart rate up and, get you going, get your blood pumping. It's been shown to have a reduced risk of age-related loss of function compared to the general aging population. So, and we're focusing on this age group a little bit here because this is a lot of questions that I get from my patients who are, getting a little older and very careful about what they're doing. They don't want to do anything that is going to injure them, cause any issues with joints and muscle, because we don't want to set back. You're injured and you're off from any exercise for 6 months, and then when you restart, it takes a while to get back there. So that's, we wanted to give you more tips on how to be safe with your exercises at this age.
So to break it down a little further, so when we think of aerobic physical activity, the schedule that has been shown to actually produce good benefits is having at least 3 days a week of aerobic activity. And you mix in 2 days a week, at least 2 days of muscle strengthening. So that's what your day should look like. Now, with regards to intensity, of course, like we said before, it depends on where you are, what your limitations are. So there's two main groups. Look at absolute intensity and relative. Now, if you look at absolute here on the slide, it pretty much mirrors regular intensity scales. So you look at light intensity activity, 1.6 to 2.9. Now it says it times the amount of energy expended. That's like a code for METs. So if you think about it, anything below 3 is below 3 on 3 METs is light intensity. And that's like you at rest. Moderate intensity activities from 3 up to 6, and an example, a cheat sheet way, is when you're doing the activity, like I said, you can talk, but you cannot sing. That's the cheat sheet way of looking at, am I doing something that's moderate? Vigorous, you'll know, because it's usually 6 and above times, or 6 and above METs. And that's when you're doing it, you're basically, you can say a few words. I mean, you're not dying, you're not having chest issues, but it's just that it has you revved up where you can't speak freely like this. You're more
not in full sentences.
Not in full sentences. It's not a bad thing.
And I think we've all been there.
Yes.
So,
yes. And relative intensity, and that's when we sit down and we say, okay, we look at you and say, okay, here are the issues we're dealing with you, and here's what we should be doing. So it's kind of measured on a 0 to 10 scale, 0 being sitting and 10 being the maximum effort possible by you. And you know you better than anyone else does. So that's the relative intensity. And you can actually marry this to the above absolute, because if you're doing something, let's say you're walking, and during that particular walk, you can only say a few words, that's vigorous for you.
Right.
So that's something you want to definitely.
Everyone is different.
Everyone is different. So you work within your limitations, and you'll begin to progress. And of course, less fit people require higher levels of effort than people who are more fit for the same activity.
Okay, continuing on tips here. So balance activities, important again to maintain muscle strength. It helps to resist forces within or outside the body that causes falls. So falls, you got to think about this as you're getting older. And as I said, reducing your muscle mass does put you at risk for falling more easily. So we want to keep these balance activities going. So here are some examples. There's a heel to toe walking where you're stepping in front, 1 foot in front of the other, heel to toe. Practicing standing from a seated position,
Mhm.
just sitting on a chair and practicing sitting, standing. That is really important because it
Mhm.
engages the muscles of your lower extremities and your core, and it
Mhm.
helps to strengthen.
Mhm.
Strengthening muscles of the back, abdomen, legs. That's again going with those exercises and the core muscle. And focusing on activities that's going to be, we call it multi-component activities,
Mhm.
combining aerobic, muscle strengthening, balance exercises all in one. And some of these are really enjoyable exercises. I have some listed here: dancing, yoga, Tai Chi, or even gardening.
Mhm.
It involves a mix of different motions, of different types of exercises throughout doing the whole activity that will hit all of the aerobic, strengthening, and balance. And so, as I said, risk reduction is, a big deal as you get older, because we don't want you to fall, fracture, strain something, and again get put back for a few
Mhm.
months. But we want to do it smartly and, just be able to keep it going, maintain that level of exercise.
Flexibility also important. Stretching, I mentioned it before. You do enhance the ability of a joint to be able to move. So you can see improvements in range of motion, which is important. It's best done before a moderate or vigorous intensity type of activity because you want to get the joints and the muscles a little bit warm before you really go at it, And also after a really good workout, it's important to do
Right.
it to cool down. And it does help to kind of bring the heart rate down so you can go about your day and you're not feeling too burnt out.
Helps with recovery. Right?
Recovery is important after a particular workout. Yes.
All right. So, just some tips for physical activity success. We first thing, you want to make it fun. We don't
Yes.
want to make it seem like a chore at
Mm-hmm.
all. So, find something that you love doing. Whether it's
Mm-hmm.
golfing, biking, going walking with a friend. Make it fun. Dancing.
Mm-hmm.
Combining exercises and doing things like Tai Chi, which is a very enjoyable
Mm-hmm.
exercise for many.
Mm-hmm.
And everyone is different just based on your personality and what you want to do, what you enjoy doing,
Mm-hmm.
and make center it around those activities.
And of course, a good way to get into the habit of being physically active is to marry it to something that you're already doing. So, for example, after dinner, let's go for a walk. You build that habit in, and even if you go walk a dog afterwards, but you build that in, then it becomes routine, and that's what we're trying to build here. Because
Mhm.
starting from zero is difficult. It's that inertia. So being able to break off the cobwebs of being sedentary is a good way to do it by marrying it to something that you're already doing. Because we know if it's not scheduled, it usually does not get done. So having that ability to do that is key to helping improve your success in being physically active.
Definitely involve others. If
Mm-hmm.
you're that person that would love to go walking with your spouse or your family, or even a friend,
Mm-hmm.
like getting together with, you're going to go, every Wednesday at 8 a.m. with your
Mm-hmm.
friend to your Zumba class. And,
Mm-hmm.
that's a social activity,
Mm-hmm.
but you're reaping the benefits of exercise. I mean, that's a great tool, just involving others and making it fun, especially with the people you love to be around.
And no one likes to work out in a vacuum. Those of you out there, I'm sure you've heard me say, if you have a treadmill at home or elliptical, make sure it's in front of a TV. That's how we have it at our
Mhm.
house. Because I mean, having no other outside stimulus can make it pretty boring, and then it feels like a chore. But having, whether it's the TV or your Kindle, or in this particular case, using audio like
Mhm.
headphones with your
Right.
music, is key to help just kind of with that distraction. And before you know it, you've already gone 3 4 miles, and you're like, wow, that didn't take long. Especially if you're home and you don't want to go out to a gym, because we recognize patients like to do things, people like to do things at home. Having your treadmill in front of your TV is important. You're gonna watch 30 minutes of your favorite show,
Mhm.
get on a treadmill and just walk. Start light. We're not trying to head to the Olympics, not yet, but at least start light and build into it.
And definitely be inventive. Whatever you like to do,
Mm-hmm.
you don't have to stick to a strict program. I mean, yeah, there are many of these programs, whether it be a Beachbody program or
Mm-hmm.
some, there's so many apps now with the whole COVID pandemic era.
Mm-hmm.
You don't have to stick to anyone, but you may want to try out different ones, see what works for you, maybe
Mm-hmm.
mix it up a little,
Mm-hmm.
just based again on what you like to do, if you want to be around people for this, if you want to do it on your own, if you like doing one specific type of exercise, just, make sure that you're doing something that you would want to do again or want to continue with, that trajectory. So just to be successful.
And you got to be forgiving. What that means to you is life happens. And let's face
Mm-hmm.
it, oh, it's been 3 days since I worked out. I started great last week. This week has been nothing but drama. You know what? Tomorrow I'm just going to go really, really hard. No, don't do that because that leads to injury. And injury leads to more downtime. So if you slip up, didn't get to it for the last couple of days, just brush off your shoulders and just get back and just continue the course.
Mm-hmm.
Don't try to overdo to compensate for missing a couple of days of being active, because we all know it, life happens. But the main thing is, as long as your trajectory is towards being more active and being physically healthy, you keep moving that towards that path and you'll succeed.
And tracking your progress, really important, just
Very,
so that you know
very.
where you're at.
Mm-hmm.
And there are a number of tracking devices, from the Fitbit to just your watches. I mean,
Mm-hmm.
everyone has smart watches now. We have the
Mm-hmm.
Apple Watch, which you can track your
Mm-hmm.
calories, your heart rate, etc. If you're not too electronically inclined, if you want to have a schedule of tracking, this is what I do,
Mm-hmm.
how many times per week, and stick to that schedule, whatever it is. If you want to be competitive, like Dr. Morris is, and because you can do that like on most of the stuff, like the iPhone, I mean the Apple Watch, and you can share with your friends, and you guys can see how many times you're doing it per week, how many, you can even do little competitive exercises, right? You can set weekly or monthly goals, and you can have a lot of fun with it. But really important to know how much you're doing and if you're in line in what your goals are, whether it be goals for the week or goals for the month, or whatever you're tracking. But there are a number of devices out there that you can use to do this already.
And tracking is important because you can't improve what you don't keep track of. Those of
Mm-hmm.
you from the business world know that. Metrics, being able to follow through. And yes, I'm a little competitive, like Dr. Bacchus said, and she's officially blocked me from sharing my data with her because
Yep.
she would repeatedly say she doesn't like that negativity in her life. But yes, but it is important to keep track of these things because, I mean, you want to see where you were and you want to see where you are and you kind of want to shoot for where you want to be.
Absolutely.
So it's
We can
important to keep
always
that.
improve.
Always.
And that's what we aim to do, like do a little better next time, for sure. Safely, of course.